Thomas. We're going to continue our assessment with looking at your upper extremities, lower extremities, and spine. Okay. Then we'll be finished with the assessment. So first I'm going to have you hold your arms out, and we're going to look at your wrists. There's no bruising, no swelling. Your elbows, both of them look good. No redness, no swelling, no bumps, no bony prominences that are normal. Okay. All right, and I'm going to have you look at your wrists. So I'm going to look at your carpal metacarpal joints. Okay, and then I'm going to look at your metacarpophalangeal joints, and as well as your inner phalangeal joints, your proximal and your distal. Okay, over here as well. I'm going to have you make a fist. Okay. All right. And then spread your fingers out, extend. Okay. And then make a claw. All right. No abnormalities there. And then I'm going to have you, make a fist like this, and take your thumb. You can relax your hand. Take your thumb and point it to the bottom of your pinky finger right here. Good. And then I'm going to test the strength of your fingers. So I'll have you, just like this. And then when I put my fingers here, you're going to extend your fingers against resistance. Good. And again. Great. Now put your fingers like this, or your hand like that. I'm going to put my fingers on yours, and then you pull back to your palm. Good. And do the same with your thumb. Wonderful. I'm going to palpate the wrist firmly. Any problems there? No? Any problems there? No. All right, I want you to flex your wrist, both of your wrists. So flex and extend. Good. And then deviation of the wrist radially, so this way, or you can actually have your hands out like this, this way and out. Good. Yeah, keeping your elbows in. I'm gonna test the strength of your wrist, so make a fist, and then pull your wrist back up to the ceiling against me, and against me as well, and same over here. Okay, now we're gonna move on to your elbows. I'm going to just palpate your elbow here. Any soreness or tenderness? Okay. And we're going to, the bursa is not swollen on either side. I'm going to have you flex and extend, right? And then against resistance, both sides, pull and push. Good. And I'm going to have you take your, put your arms out like that, and pray. Alright, and then we're going to look at your shoulder. So, sternoclavicular joint is where I'm going to palpate. And then acromioclavicular joint. And subdeltoid bursa, as well as the bicipital tendon. I'm going to come from behind. And then go pull your arm back. Feel for the bursa. Alright, I'm going to do the same on this side. Good. Okay. Now I'm going to have you do a few things for me. I want you to take your arms above your head and then reach behind your head. Good, good. And then I want you to take both hands and reach behind and try to reach the back of your neck. Okay. To the opposite side of, yeah, opposite side, yep. Good. And then I want you to cross your arm over to the other shoulder, and same with the other opposite arm, good. And then I'm going to have you, stand at a neutral position, and I want you to have the arms go all the way up to the ceiling above your head. And then I'm going to have you do the same thing, but just out of the side. Good. Yep, up to the top. And kind of did this already, but if you keep your arms out to the side and then pull, up and down. And then in testing your shoulder strength, I'm going to have you hold your arms out like you're going to empty beer cans or soda cans. And then I'm going to push down and you push against me. Yep, good. And then have your elbows to the side. And then I'm going to push in and you push out. Okay. Okay, Mrs. Thomas, we're going to move to the lower extremity portion of the assessment. So I'm going to take a look at your legs and your hips, which are well aligned, your knees, your legs are straight, toned, and your ankles. Any problems with any of your joints? No? Okay. I'm going to have you, I'm going to bring this table over. I'm going to have you lay down on the table and on your side. Okay. I'm going to feel for your hip joint and bursa here. Okay, good. Now what I'm going to have you do is with your hip, I want you to flex your hip in up to your chest and then all the way back as far as you can with your leg. Good. Now we're going to add resistance to that. So I'm going to pull down, you pull in, and I'm going to push forward, you push back. All right. I'm going to do the same thing to the other side. Bend your knee a little bit. Okay, no abnormalities there. All right, we're going to do the same thing, your knee to your chest and out behind you. All right, and then we're going to add resistance. So I'm going to pull, and now I'm going to push. Wonderful. All right, I'm going to have you lay on your back. And now we're going to do some more exercises with your hips. Bend this knee right here, and I'm going to just move your knee in and out, your leg, lower leg in and out. We're going to do internal and external. All right. And then I'm going to abduct and adduct your hip. Okay, we're going to do the same to the other side. Internal rotation, external, good, and then abduct and adduct. All right, do you have any pain? Okay. All right, now we're going to move down to the knees. Okay. I'm going to feel for your tibiofemoral joints. All right, and just keep your legs nice and straight, and I'm going to move these patellas freely. Do you have any problems with your knee joints at all? Any swelling, any pain? No. Okay. All right, what we're going to do is I'm going to have you lift your knee up and then extend your knee, right? And then with resistance, I'm going to keep you from trying to lift your knee up. Okay. All right, now push. Same with this leg. Okay, push. Good. All right, I'm going to come down to your ankles here. Feeling your ankles, medial and lateral. I'm going to feel your Achilles tendon and your bursa. All right, I'm going to move to the other side. And for the bursa, Achilles tendon. All right. I want you to flex your ankles up to your chest and extend. Now I'm going to add some resistance. So up to your chest, extend. Good. And now I'm going to have you, just to keep your ankles straight, leg straight. I'm going to move your heel right here, internally and externally. Internally and externally. And then I'm also going to move this up here. Internal and external rotation. Good. Alright, I'm going to feel your joints of your toes. No swelling. Your joints seem to be normal. Alright, and I'm going to have you do the same thing with your toes. I want you to flex your toes up to your chest and down to the ground. And then I'm going to add some resistance with my fingers. So up and then push. Great. Okay, thank you. This bonus, we are at the final stage of the assessment, which is the spine. So what I'm going to have you do is turn around so I can see your back. Okay. Alright, and you go ahead and lift your shirt up to your neck. Alright, and I'm just looking at your back. Alright, go ahead and stand up straight. I'll hold your shirt for you. And have your arms down at your side. Okay? I don't see any scoliosis or kyphosis. Alright, you got it. Okay. Go ahead and face me. And what we're going to do is some cervical practices, some range of motion. So touch your chin to your chest, good, and look at the ceiling, extend your head as far back as possible. Alright, now we're going to try to move our chin to each shoulder, good, as far as possible, alright, and then touch your ears to your shoulder, great. Alright, now we're going to have you turn around once more, and go lift your shirt, and I'm going to feel each spinous process here, from your neck down. Soreness. Alright, my hands are cold, I apologize. I'm going to feel for your bottom of your rib cage here. Okay. Any soreness there? Any soreness? Okay. Okay, you can put your shirt back down. Now we're going to do a little bit more range of motion. First, what I want you to do is bend over to the floor. Okay, good. Yeah, you can touch your toes. All right, do that once more and stay in that position. Okay, stay right there. Just going to assess, see that your spine is straight. Okay, looks great. Now we're going to go ahead and extend from the hips back. All right, good. All right, I'm going to come over here. I'm going to hold your hips, and what I want you to do is rock your side of the body to the right, and to the left. All right, now I want you to turn your head and your whole body from their hips up to the right, and to the left. Good. All right, and we're done.